Hello, my name is Bertanava and I will be recording and giving you a tour of our hospital. So over here to our left is the Bay Area for ambulance drop-offs. And back to my right, here is our entranceway to our ER room. Over here you will immediately see the security office. This is to ensure your safety and of our staff. Over here is a pharmacy, just so in case you can pick up medications or anything else you need during your visit. And after entering, you will be met with 2 receptionists to check in. While waiting for your call, here is our very spacious waiting room and some restrooms for your convenience, as well as a small kid area. When being called, you'll be brought over here. And back over here is our Bay Area for immediate access. Over here is our triage and patient rooms. We have multiple for the convenience and quick work, as well as our exit. Over here is a second security office, as well as a janitor room. Now over here we have another exit, as well as our radiologist room. Over here, as you can see. Now over here is our operating room, where surgeries will take place. And over here is our biomedical innovation. This works like an elevator. This will drop off supplies like organs and other things from the second floor of our other operating room for easy access. And over here in this corner is our other supply drop-off area, which includes stuff for nurses and other surgery things. Over here is another exit, and here is our elevator, which will take us to the second story. And over here is our second floor. Here is a little waiting room / lunch area for our nurses and other hospital patients, as well as some vending machines. Here we have more supplies of restrooms. And over here is our second floor operating room. And here is our innovation. Here's a look into it. And over here we have some waiting area and also another radiologist. We have 2 rooms. And over onto this corner is another waiting area for patients and beds. Another area is more patient / triage rooms, as well as physicians. Now heading to our roof area. And here's our roof with our little helicopter pad. We have access to helicopters for immediate transfers. And that is all for our hospital. Thank you for visiting.
Okay, so this is our staffing schedule for all 47 of our staff. And then we're gonna talk about our patients now. So our first patient is is Dolores. She is a female, and the patient slipped from getting out of the shower. She is unable to put pressure on her right leg and complains of wrist pain. So currently she's on oral estrogen and Lopressor. So the patient is a 72-year-old woman with history of high blood pressure. She has recently been unsteady and has broken four broken bones in the past 2 months. Two of these were breaks from minor home accidents. The patient noted that she has not been cooking much for herself since her husband died 2 years ago and relies on frozen meals. The patient called 911 from her home. Her right wrist and right ankle were extremely swollen and discolored. The patient can put little to no weight on the right leg. Blood pressure, heart rate, and respiration appear to be stable. The patient has a fractured right ankle and a sprained right wrist. And since the patient is older and not getting enough nutrition or exercise, the bones are prone to injury. I
Doris has multiple fractures, she'll be considered urgent, so she'll have to go through the check-in since she's not emergent. Once she's done with the check-in and she's done all her information, she'll be headed to the examination room where she'll be checked for her broken bones, um, such as to see if what bones are broken and what needs to be addressed. Uh, then she'll be proceeded to one of the triage rooms, and the doctor will come over and she or he will prescribe the treatment that Doris needs, such as having a cast to help steady her bones, or recommending her to physical therapy if she's unable to walk.
And our second patient is Haley, and she is also a female. So the patient was pinned in a car following a motor vehicle accident. A piece of the metal is still lodged in the patient's chest, and the patient is having trouble breathing. Currently, she's on currently she's on no types of meds, but has a latex allergy. So the crews were able to extract the patient, but after 2 hours of work, EMS on the scene worked to stabilize the patient while she was still in the car. Patients received oxygen by mask and fluid via central lines, and pressure bandages were placed on the chest. The patient has no significant medical history, but does have a severe latex allergy. So the patient's breathing is shallow and the pulse is thready. She is unconscious. She was unconscious when she reached the ER and has been shocked twice by the defibrillator in the hospital in the helicopter, but is currently stable. The blood loss is significant and metal shards remain lodged in her chest and left thigh. The patient has does not seem to have punctured or injured any other bone or organ.
Our patient Haley, she suffered from a motor accident, which means she's suffering from blood loss and currently has a metal piece lodged in her. Therefore, she is a emergent patient and would need critical care immediately. We would bring her down this elevator into the emergency room from the helicopter pad. Now she would be brought into trauma bay where they will stabilize her and ensure she is not still bleeding. What's wrong? Okay. Our patient will be brought into trauma bay where she will be monitored and have bleed control. After our patient is stabilized, she will be brought to the imaging room where they will check whether she has metal pieces or any internal injuries. When this is established, she will be brought to the surgery room. Here, Haley will be brought into the operating room where they will remove any metal pieces and take care of any wounds that she still has. When this is all under control and she is monitored and stabilized again, she will be discharged from the emergency room.
Thank you for visiting our Bloxburg Hospital.